A new tragic record from the United States. More than 2,700 people died with coronavirus on Wednesday alone. That's the highest figure since the pandemic began. The country has been hit by a surge in coronavirus infections. More than 100,000 Americans are in hospital and health resources are becoming increasingly stretched. The top disease control official, Dr. Robert Redfield, has warned the next 3 months could be the most difficult in America's public health history. And he said the US is facing a devastating winter unless public health advice is heeded.
You know, we looked at the original spring, we lost about 100,000 people. The summer, 100,000 people. The fall, 100,000 people. These are, sacred lives that were lost as a consequence of this pandemic. We're potentially looking at, another 150 to 200,000 people before we get into February. So this is really a significant time.
Well, the mayor of Los Angeles has issued an emergency order for the city's residents to stay at home with immediate effect, following what health officials described a terrifying increase in cases of the disease. Peter Chin-Hong is a professor of medicine and an infectious disease specialist at the University of California, San Francisco. Good to talk to you, Peter, again. Just tell us how things are there.
Well, things are very grim right now, Karen. We've had the 4th straight day of increase in hospitalizations. And of course, once we see our hospitals being filled up and our ICU beds being taken, we're in dire straits.
How close are you to that point, or have you reached that point already?
Well, there is some variation across the state. In some counties, for example, in Northern California, there is upwards of 90% occupancy of ICU beds. In other counties, 80%. In my own hospital, we've seen 2 to 3 times increase in hospitalizations due to COVID in the last month alone.
That is an extraordinary increase in a relatively short time. Peter, I just wonder what is going wrong that we have reached this point, and it seems to just be getting worse there.
Yeah, so there are 3 main factors, I think, that make this wave very different from the previous waves in the US. The first is, of course, the season. In previous waves, people were able to mitigate risk by going outdoors. Currently, there is no respite, so people are gathering more indoors. The second, of course, is pandemic fatigue. Some have recasted this as pandemic resentment. And the third, of course, is the fire that's COVID all around the country, so that there's no real, escape, so to speak. California is being boxed in after having a relatively unscathed past.
And Peter, it was Thanksgiving, just a week ago. I suppose we're yet to see the impact that may yet have.
Exactly, and that's why it's very dire right now, because it's a surge on top of a surge. And when you think about Christmas, that's a surge on top of a surge on top of a surge. So in Thanksgiving, that was a record travel day for the US for the year, with more than 1 million people traveling. So if you think about that, that's really going to be looking really bad in about 2 weeks.
Right. So as we've been hearing from many officials, the worst could still be yet to come.
Yes, exactly. And we're just bracing ourselves right now.
You've talked about capacity in ICU reaching, 80 to 90% in full in some places. Just tell us what it is like in hospitals at the moment. What is it like in your hospital?
So I think what it's like, it's very quiet, eerily quiet. It's austere. People a little bit demoralized because of just the marathon that the last few months have been. We thought we'd be over it by now, but it's even getting worse. And I think we're just trying to brace ourselves for the last mile of the marathon, where it seems that we're running out of water.
Right. You say you're approaching the last mile of the marathon. How much hope, how much energy does it give you that perhaps you could be seeing a turning point with the vaccine soon to arrive?
Yes, so I think the vaccine is the light at the end of the tunnel, but it will take some time to fully roll out. Healthcare workers are going to be prioritized. My hospital is going to be one of the first 7 hospitals in the state to get it. So we're planning that right now. So on December 10th, the FDA will meet to formally approve it. We're a little bit behind the UK. And hours after, it's said that we'll begin distributing these vaccines to healthcare workers.